Afternoon, everyone. You are in the equity session. What we want, a vision for the future of caregiving. Before we get started, I want to just go through a couple housekeeping notes. We do have interpreter services. Miguel, are you on the line?
Yes, I'm here.
Great. If you need interpretación del idioma, click on el icono del mundo. Also, there is closed captioning during this session. And lastly, I want to just bring your attention to our practice agreements on the right-hand side of your screen. Those include be present and accountable, be brave and be inclusive, take space and make space, and address racially biased systems and norms. And with that, I am pleased to introduce you to our panelists, and I will hand it off to Shalisa Martinez, our moderator.
Thank you, Keely. Good afternoon, everyone, and welcome to What We Want, a vision for our future of caregiving. This is a very exciting panel for me. I'm very glad to be here today with you. In my role with the summit, I worked with the Equity Design Group to think about what does equity mean when it comes to caregiving. This was a very diverse group from all across the nation. It included people who are working as caregivers in a professional sense, and also family caregivers, and of course, many of us who have both roles. Over our time together in the fall and the winter this past year, we talked a lot about some of the challenges around caregiving and equity in caregiving. Challenges like, for example, the history of caregiving here in the United States, and how caregiving historically has been something that's been done mainly by Black, Indigenous women of color and immigrant women, and how this has shaped how people and policymakers understand and value caregiving now and caregivers. We also talked about labor practices and people's understanding of caregiving, institutional racism in healthcare, the marginalization of people who have disabilities, and how this has shaped what policymakers and other people think about family caregivers. We also talked a lot about solutions. We talked about, for example, the need for caregivers to have more advocacy, the need for caregivers to unionize and mobilize together so that we can have a collective voice. We also talked about additional support that's needed for caregivers, not only a living wage, healthcare, but essential needs that we have. We also talked about long-term investment in communities of color, and caregivers needing access to all sorts of resources, and of course, valuing caregivers, both paid and unpaid, as equal members of our care teams. Now I will go ahead and I'll introduce, I'll introduce a lot of our panel, excuse me. And then I'll also remind everyone that at the end of the session, we will have time for Q&A. So now I'm going to ask each member of the panel to please just introduce yourself and also just share with us what is important for us to know about your caregiving story and journey. So let's first start with Debbie.
Hi, I am Debbie Harris, and I am the mother of a 28-year-old young man. His name is Joshua, and Josh was born prematurely, largely because my doctor group would not listen to concerns I had about what was happening during my pregnancy. So it was actually an accident or a neglect. Josh had a grade 4 brain hemorrhage at birth and subsequently has cerebral palsy, spastic quadriplegia, and he has a trach. He's on a ventilator. He gets 24-hour feedings through a tube and a pump. He has an implanted pump for his muscle tone. He's non-ambulatory and he is nonverbal, but he is very vocal and he is very delightful. And our caregiving journey, it started by surprise, but we have learned how to manage it and how to ask the right questions along the way and how to navigate the challenges, which have been extremely difficult as we faced many intersections of race and disability along the way that made it a lot harder than it had to be. So we're grateful for the journey, basically and mostly because we still have Josh with us. So that has been the prize. So that's our story. And I'm just grateful to be here to talk with you all today.
Thank you, Jackie. Thank you, Debbie. Now I'm going to ask Jackie to please introduce herself and share with us her caregiving journey, please.
Hi, my name is Jacqueline Cusick. I was a in-home health care aide for Catholic Charities for about 10 years until last year in March when the pandemic hit. What's important about my caregiving story is that at that particular time, I was caring for my husband who passed a few days before we actually went into shutdown. I went from working full time to working 2 days a week because I had to give my full attention to taking care of him, making sure that he was safe. He was falling a lot. We eventually found out that he had a hematoma, a brain bleed, and that's why his balance was so off. But he was in end stage kidney failure, and I just had to devote the majority of my time to taking care of him. And I guess it's really important. My story is important because it just all just happened at that particular time. Um, before the pandemic, where things happened, trying to make sure that he was taken care of, feeling that there were things that the hospital and the doctors were doing that just really wasn't conducive to his care. And it's difficult. It's still difficult, but that was a major part of my caregiving story, having to try my best to just keep him alive, but it not, working out that way, and wondering what I could have done differently, what could the hospital have done differently. But at the same time, it happened during the pandemic, and I think about the fact that what if he hadn't died? Would I have been able to live with not being able to go and check on him to make sure that he was okay? So that's a very important part of my caregiving story.
Thank you for sharing that with us, Jackie. Now I'll ask Maya if you could just please introduce yourself and also share with us your caregiving journey. Maya, you're on mute. Yeah.
Thank you. My name is Maya Jackson. I am from Durham, North Carolina. I am a mother of 4 children between the ages of 13, 11, 2, and 4. Before the pandemic, yep, I understand. Before the pandemic, I was, and I would say a few months before the pandemic had even started, I had been laid off because I was a mother. I had only been employed for 3 weeks. I could tell, every time I came to work and I wanted to pump or to drop off milk, to daycare during my break, it was a problem. And then when my children got sick, because when one gets sick, they all get sick. I stayed out. I think I was out from Friday until Wednesday. And Wednesday I came back and I was fired from my job with no notice. And within that, I was immediately pushed into caring for my grandmother because a loved one was incarcerated. And so I was managing 4 young children on top of my grandmother. And then during that time, I was also training to become a doula because not having a strong support system, while pregnant was a lot mentally, physically, and emotionally. And so I wanted to be able to give back to my community in a way that my doula had supported me through my last 2 pregnancies. And within that work, finding out how little support my community had in regards to providing resources and postpartum support for families, I could see, similar to Debbie's story and Jackie, the amount of medical neglect and disregard for folks advocating for themselves and the type of support they needed. So by the time the pandemic hit, I had been on the ground in the community, trying to be another voice, addressing those concerns. And then when the hospitals all shut down to the amount of people that could be in the room, which removed doulas from providing support to birthing people, we then had to find other ways to support members in the community. So personally, I am a caregiver based off of my household and my loved ones, but professionally, it's the work that I have taken on to be a better advocate for folks that need continuous care and support.
Thank you, Maya. So a big part of the work that we did back in the fall with the equity design group was folks just sharing their experiences similar to what Debbie, Jacqueline, and Maya just did. And a big part of that was also sharing, the things that they were most proud of, the things that made them the most happy being a caregiver. So I would like to invite our panelists today to also share with us, what are you most proud of as a caregiver? And let's start with Jackie, please.
I guess looking back on the fact that I ended up being my husband's main caregiver, what I'm most proud of is that that I did it. I think now, I think about it now and I wonder, how did I do it? But I did it because there just wasn't any choice. And I wonder, how did I do it? Or why did I do it by myself? Why didn't I ask for help? Why didn't I say I needed help? But at that time, I just felt like there wasn't anybody that could take care of him as well as I could. Maybe that wasn't, a rational thought to have. But at that particular time, I had a system of doing things. I had a schedule. It was like an outline, and I did it. It was very difficult, but I did do it. And I'm proud of the fact that I did do it. I'm proud of the fact that I was able to take care of him and that I was able to be there and advocate for him. Um, Sometimes I think back on it, I wish I had been a little bit more patient with him. I did lose my temper sometimes because if anybody is taking care of a sick man, you know how they can be. They can be defiant. They can want to do things their way. And a lot of the times you end up being in the situation that you are because they did not listen to you and seek out the care at the proper time when you wanted them to get care. It's like they have to get to a point where it's almost over, and it is over, and there's nothing that can be done before they'll go to the hospital or they'll seek, seek care. But I look back on it and I'm just proud that I didn't give up, that I took care of him and that I was there for him. And I'm proud of the fact that I did it.
Thank you, Jackie. Maya, would you like to share with us, what are you most proud of as a caregiver?
Yes, I think personally the time that I've been able to have with loved ones and my children, when I look back at my older two girls, I was working constantly, nonstop. If I wasn't working during the weekday, I was working during the weekend, and so I missed a lot of those key moments when they were much younger. And so now that I've been able to have more time with my children, my younger children, I've been able to provide support that they may not have gotten. Especially my youngest one, she has some developmental delays. And so, we could never afford the amount of therapy and things that she needs. But I know that the time I've been able to be in the home with her, has been extremely beneficial to her development. But also that time I've had with my grandmother. My mom passed away in 2013, so that she was my lifeline, you know, my connection to my grandmother. And so to be able to provide her with support throughout last year, even though I could not see her and hold her, I snuck away like one time to like give her a hug as things start to get better. But she ended up passing away this past December due to COVID. And so just to be able to be with her in that moment, to be able to give additional support when no one else could be there was definitely beautiful. And then just also to be able to help the families that I've been able to help over the past year who either don't have their own network or village of folks here, but to also see what's going on in the room in the hospitals, and then to be able to be on advisory boards and to advocate directly to get some policy changes. I think that's been a great experience as well, to provide additional support that these families need.
Thank you, Maya. And Debbie, would you like to share with us some of your
Sure.
as well as a caregiver?
Sure. You know, when Josh was born, I was devastated. He was 7 months, and it's not so premature nowadays, you know, because of the technology. But at that time, he was the sickest baby in the NICU. And because Josh's brain hemorrhage was so devastating as well, there were intensivists there who didn't want to treat him. But we knew, just because he was our youngest boy, that he just had this like will to live, and he just seemed strong and robust. He was off of the ventilator initially after 3 days. And so we could just tell that he had this will to live. And so we advocated for him, and it wasn't like they had to do anything heroic. He was kind of doing it on his own. We got a lot of pushback, and we got a lot of comments like, you know, a medical social worker saying to us, you know, I've heard a lot of scuttlebutt in the hospital, and people don't agree with your decisions for Josh, and things like that made us feel unwanted, and like they didn't want Josh there. But we also had a lot of advocates there as well, and people who helped us to learn how to ask the right questions and become like the best advocates for him ourselves. And so over the years, I tried to learn the system that we had to work within, the medical system, by just joining them, like becoming a parent representative on the ethics committee. And it was hard because people didn't agree with, you know, treating kids who had profound disabilities, and being on the research committee and working with residents and whatever I could do to learn the system. And after many years, people began to respect what we did and respect Josh's journey, and actually come back to us later on and say that to us. And so that's one thing. Another thing is that it helped not only Josh's quality of life, but as we went through this journey and other family members became ill, they kind of like came to us to help with their journeys as well. So even though they had chronic illness or even terminal illness, it helped in their journey to have it be more comfortable and more at ease, to put them at ease, and to help it to help us all through it in the best way possible. So, for example, Josh has what's called an intrathecal baclofen pump to help with his tone. And I have a brother who has MS, and he really needed the same type of pump, but it was really, really hesitant to have something like that implanted in him. And we had done research on it for like 3 years. And it was comforting to him that we did the research and Josh had it first. And then my brother finally got it. It was like the best thing that he did. And when my mom, who was like just our like such a support to us, was diagnosed with an adenocarcinoma, it just helped in her journey, and having her watch Josh and his strength and our strength with him, it helped her to have faith and inspiration to get through her illness in the best way until she passed away. But then she made choices for herself that helped her pass with the most dignity as well. And it was so inspired by Josh's journey. And with my dad, who didn't even believe that Josh really was viable at the beginning, he became like the closest person to him. He became a caregiver for Joshua, and he actually worked with Josh like 5 evenings a week and called him buddy buddy. And they were like the closest to people that you'd ever see. And my dad had, we didn't even realize, but he had a tumor growing all the way up his spine, but still came to work with Joshua. Didn't tell us. The last night he worked with us, he called in and called me and asked if he could pick up a roasted chicken for me from Kowalski's. So we didn't even know the pain that he was in, because he was insistent upon coming here and being with Joshua. And then the next night he like passed, he fell, and then he didn't ever come back. But he was just so concerned about being with Joshua. And so our journey, it touched everybody in our family. And so I think that's what makes me the proudest. And so now, like, if someone gets ill, they say, if something happens to me, call Debbie and Victor. I want them to advocate for me. I want them to be there, because I know that they will ask the right questions. They'll help make the best decisions. And also his brothers, they grew up, and we wanted to normalize this for them. Mm-hmm. And so my aunt, who is, she's retired now, we just celebrated her 91st birthday, but she's a special education professor in New York. And I remember at the beginning, she said, well, if you bring that baby home, you'll ruin the other boys. And I was so devastated by that, because I wanted all the kids to be okay. And so I took that to heart. So we worked really hard to normalize life for every one of our boys. And I just am so happy to look back and see how close they all are. And the only thing that I felt like was like about 2 years ago, the boys finally had a fight about Josh. I mean, like wrestling fight. and I was so sad, because I thought my aunt was right. We've ruined, they're ruined, but it was the only fight they've ever had. And the fight was about who took care of Josh the best. Wow. And my husband, who's a Marine, just came running up the steps, and my boys are they're big old boys. And he just took one arm and just picked them both up off the floor and tossed them aside and like, get to your rooms. And they were terrified. But I guess, looking at the bright side, at least they were fighting about who took the best care of their brother. So just looking back after 28 years, even though life is really, really hard, it's going to be that way anyway. But when you look back and see the positive aspects of this in all its difficulty, it worked out, it blessed people's lives. So that's what I'm most proud of.
Thank you. Thank you, Debbie. So, a lot of the conversation that we had with them among the members of the equity design team was about how, very similar to some of the stories that you've just shared about how challenging caregiving can be, particularly family caregiving. But even though it's very challenging, very difficult, and also sometimes folks feel very lonely in that journey, the consensus among all of the group was that, caregiving is not a burden. Sometimes we see caregiving being called a burden by folks who do not understand it. And one of the things that I really learned and I really appreciate from learning from the design team members was the caregiving itself is not the burden. The burden is all of the other barriers that we have to encounter, the barriers within healthcare, the barriers dealing with our community, the barriers dealing with just being able to access basic needs, being able to access education for our family members. So I wanted just us to have some time here today to talk about what are some barriers that you have faced as a caregiver, and what would you change, or how would you change the way caregiving is supported? And I want to start with Maya this time, please.
I think that we have to start as a society, particularly in this country, we have to start looking at things from a collective lens instead of we are as individuals, because that has just not ever worked in this country. It has never been healthy for us to be productive, in which um, everyone feels valued and, a part of what we call this country. And you can tell that that system is not working because we're in this situation now. I mean, COVID already showed, highlighted more of disparities that people were already dealing with, but it wasn't COVID that created this problem, it was society. And so when we think about like all the institutions that you were mentioning, Shalisa, depending on your particular background, there are going to be multiple barriers that you're going to face to access these resources. And for some folks, it's easier than others to be able to attain them. But then there's no remedy to ensure that others don't have to deal with the hardships to be able to get that support. So, for example, where I live, and it could be in other places, like being a doula is not something that is accessible for all. It is very expensive. Not a lot of families can afford childbirth education classes to kind of prep and prepare for birth. The classes can range between $100 to $300. If you are an individual that doesn't qualify for Medicaid, then you can't qualify for these resources that are available within the state. That means you also don't have insurance to support you during your pregnancy. That then creates a ripple effect of cost and hardship on the individual, but only on all the other institutions that are supposed to support families as well, because then they don't know where to send people or to help navigate people. And so then, people get left in the silos on their own to try to figure this out. Then that creates a ripple effect of like health disparities, because stress creates disease. So it's just almost like this never ending, I guess, one of those rotating elevators where people are like going in and going out with no point of direction of how they are supposed to be able to access the support, to get the support they need to support their families, but also themselves, because caregivers for a lot of times are not even factored into these situations.
Thank you. I want to go to Debbie. What are some barriers that you face as a caregiver, and how would you change the way caregiving is supported?
I think there are resources available, but they're not distributed equitably. And there are too many instances where, depending on your county or the worker that oversees your case or whatever, you get different treatment, different assessment, and different access to those resources. So we need to stop criminalizing, brutalizing, and stressing out caregivers. And by that, I mean this. So we have a small nursing staff for our son, Joshua, because it's really difficult to get home care nursing these days. There's a nursing shortage. There's a huge population of older people who need nursing. And then those of us who have younger people with complex medical needs who need nursing care in the home to keep them out of institutions. And the pay is not competitive when you compare the pay that they receive in home care nursing to hospital nursing. And so we have a program here where we can use like a home and community-based waiver to be flexible and like pay our nurses like a bonus to establish like continuity of care for those nurses who show like commitment and devotion to our son's care, people that we hire, like we refer and we trust, and who have shown that they will stay with our case. So we have nurses who are going on 6 years here with Josh. So we, every year in our budget, propose this bonus so we can try to make their pay a little bit more sustainable and equitable, because going through the nursing agencies, the benefits are awful. They take a huge chunk of their 2-week pay to pay for insurance and other benefits. And the benefits that they do receive from that are just basically catastrophic benefits. And so it helps to be able to give them a little bit extra so that they can be compelled to stay on the case. And also, young people like Josh, he could go into the hospital anytime. And during a pandemic, it's not like they can go on to another case. So they couldn't train in another case or anything like that. So it's something that's needed. When it came up to be time for us to redo our budget, the caseworker with the county gave us so much trouble, just in saying, well, how are you justifying this bonus, which we've been paying for years? And it was just from one day to the next, and it was the same exact people, the same exact bonus, and essentially the same amount. And there was no reason for it. It caused me a lot of stress. It caused the nurses a lot of stress because it would affect their income. And it jeopardized Josh's safety. And so it was a new person though. And so after a while of going through this, like weeks of going through this, I suspected that it had something to do with what her biases might be. And so finally I said, you know what, we need to have a Zoom call. And I didn't know what she didn't know anything about Joshua. So I said, Josh is going to be on the Zoom call. So I had him in the picture, he's in his bed, he's on his ventilator, she could see what his condition was. Mm-hmm. And then I put the nurse on, and this is what happened. The nurse that day was a young white male millennial. And as soon as she saw him, her whole disposition changed, and she immediately approved the bonus. And so I think prior to that, she thought maybe we were running a racket or something like that. And she said immediately, oh, the bonuses are approved. And so things like that have no place whatsoever in this equation. It should not happen. Our lives are difficult enough with all that, what I call foolishness. And so we need to get rid of that, and so people who are in positions of power need to dismiss that and just take their chances and just assume that, they're here to make life a little bit more comfortable and easier for us and the people that we care for. And those biases just simply make it much more difficult and put those people in jeopardy that we're caring for. So.
Thank you, Debbie. So Jackie, would you like to describe some of the barriers that you face as a caregiver, and how would you change the way that caregiving is supported?
Well, one of the barriers that I did face as being a caregiver for my husband was that when I look back on the situation, I don't think the doctors were really listening to me, because as I said before, he went in with a hematoma, which was blood on his brain. And that's serious anytime they go into the brain. So he was in what they call the STIC unit, the surgical trauma intensive care unit. And I felt that after being on the STIC unit, they were talking about automatically just transferring him out to rehab. But from my experience, I didn't think that that was wise, because it's normal when a person is in a STIC unit that you transfer them to a medical surgical floor to make sure that they are stable to be transferred out. And I kept asking the questions, well, shouldn't he go to a med surg floor before you transfer him out to rehab? And they kept saying, oh no, he's doing good. There's nothing else we can do for him, but he's lethargic. How is it that he can go to a rehab center and he's lethargic? You've got to put him on, he's got to go to a medical surgical floor. But they kept telling me no. And so, as I said before, he ended up staying in the STIC unit because then he developed pneumonia. Now, this was on a Friday when they told me that he had pneumonia. And then that Monday, 2 days later, the pneumonia was supposed to have been cleared up. And I think back now, I guess I was just so overwhelmed, but I guess what I think back now, what I should have said was, look, this is ridiculous. How do someone get rid of pneumonia in 2 days? If you transfer my husband out and you're telling me that this pneumonia is cleared up, I'm just going to sue the hell out of everybody up in here. And I think that they probably would have listened to me, but they transferred him out, and he wasn't at the rehab center for 12 hours before I got a call from my sister-in-law. And she was with him, and she said, he's not breathing, he's blue. And he ended back up in the hospital. He was down for 30 minutes. So you know what that means. Somebody goes for oxygen for 30 minutes, But what was amazing to me is that when I got his death certificate, one of the causes of death was pneumonia. And I'm like, well, how was one of the causes of death pneumonia if you cleared the pneumonia up? So one of the barriers that I would say to anyone, if you think that something is wrong and that something should be done or that they're not doing it, if they may want to call security on you and say they're gonna have you put out, but I think that once they hear the word lawsuit, they're gonna want to make sure that everything is done correctly. And I wish that I had not faced that barrier. But one of the ways that I think that caregiving can be supported is that we just need more resources. By doing in-home health care, a lot of these agencies, and some of them are good, they do pay well, but you really need to compensate the in-home healthcare workers. A lot of us really do care about our clients. I cared about my clients. I was with clients for 4 and 5 years, and I had one lady I was taking care of for 5 years. She went into rehab. And I tried to wait until she came out, but I needed to go back to work. And so she got reassigned someone else. And she was like calling me every day, wondering if she could get me back. But I had started taking care of someone else. And I just didn't think, it was fair for me to leave the one lady who was pretty attached to me by then also to come back to take care of her. And it just wasn't possible. But I think that as far as supporting the caregivers, we need better compensation. We need incentives. And also, like I said, I worked for 10 years for Catholic Charities. Catholic Charities will not hire CNAs. And I am a CNA. So when I would go in and take care of my clients, I knew how to give a proper bed bath. I knew how to change a bed with the patient still inside the bed. I knew how to move that patient without hurting myself or hurting her. But Catholic Charities, they refuse to hire CNAs. And I'm assuming it's because they do not want to pay a CNA what she is worth. But at the same time, if you're not going to hire CNAs, then you need to make sure the people that you are hiring know how to give a proper bed bath. They know how to change that person while they're in the bed, that they know how to do good body mechanics, that they know CPR, that they know proper interaction with the patients. And it's just a lot that we need to do. Home health care aides, we're doing all of the dirty work, but we're not being compensated or taken care of the way that we should, because we're doing the heavy lifting, we're doing all of the work, and it's a difficult job, but it is also an enjoyable job because it gave me joy to know that my clients would have a fit if I couldn't make it that day. It was like their world came crashing down. So, you know, pay them, compensate them, give them incentives. If you want to have a rationale saying, oh, well, we can't do it or we don't do it because you don't have a license, behind your name, then come up with something that will give them a title other than, that will make them eligible to be paid, because it's hard work and it's rewarding work, but sometimes it's a little bit disheartening when you feel like you're not appreciated.
Thank you for that, Jackie. Thank you so much. Before we turn to questions, I wanted to know if anyone wanted to share anything else that you maybe, thought or had wanted to share before, but, we have now just a little bit of time. If anyone has another thought that you would like to share around either your caregiving journey or equity in caregiving.
I'm just going to say I agree with Jackie that compensation is a must, and compensation that is equitable beyond $15, because I know that's like a big movement that everyone is trying to push, but $15 may not work in the community that your caregiver lives in. There was a peer of mine that lives maybe 2 hours away, and he frantically posted that his caregiver had quit. And I'm assuming it wasn't because of anything with him or his family, but because the company that had employed their caregiver was not paying that person enough for it to be sustainable. And so he lost a tremendous amount of help because the company didn't see the value in paying for the caregiver. And when we're thinking about all the different types of industries that involve caregiving, whether it be a CNA, nurses aid, doulas, the industries see the benefits of us being there, but until it's something where all of the work is recognized, we're going to keep seeing these gaps where people are nitpicking on what they feel like our value should be. Because like Jack said, we're with these families throughout the entire time that we're working with them. With doulas, I'm with my clients at least up to 2 years, just doing check-ins just to see how they are balancing out, and I get compensated for anything, so then that puts more of a burden on top of the caregiver, because we not are only providing care for members in our community, but we're also trying to care for ourselves and our families. So again, it goes back to that ripple effect where we have to just change the way that we see caregivers' role, so that way it could be a more balanced situation for everyone.
Yeah. Thank you. Thank you, Maya.
And I'd like to just say that as far as like the resources that pay for caregiving, allow the money to follow the person. So make sure that our supports are consumer-directed community supports, so that the person who is getting the care has control and power over who's caring for them. So don't leave that in the hands of the provider or the insurance company or whoever, the county who's controlling medical assistance or whatever, because people know who they can trust and they know who they feel comfortable with, and they know who best fits into their family dynamic. And so you hear so much, about vulnerable people being susceptible to abuse and to, other horrific things. And so exploitation and so forth. And, in our case, before we had control, before we had the flexibility of consumer direction, our son was hospitalized 4 times because we didn't have control over who agencies sent to our home to care for Joshua. And he almost died at one point and was in the pediatric intensive care unit for probably, I think, from the end of August till October on an oscillator, because his lungs were so damaged by a nurse who drowned him essentially in formula. They didn't think he was going to live. He was on 100% oxygen, and they did not think he was going to live. And so after that, I had to quit my job. Our family struggled financially for quite some time because we had to go from 2 incomes to 1. We were glad to do, because we promised him a position again where he was unsafe or we felt uncomfortable. And so it's really important to make sure that all supports are consumer directed. And since then, after that, we found a nurse who had retired from nursing from our children's hospital at 65. And she came to our home then, and she worked with our son for 15 years until she was turning 80. And that was such a blessing because she was like the best nurse we'd ever had. And she finally had to retire because she had, the osteoporosis. But I think it's so important that you can trust, like Jackie says, her clients love when she comes and they're so upset when she's not there. That is such a gift. And people should be able to live peaceably and comfortably with the people who are coming in to care for them.
Yeah, thank you, Debbie. Jackie, would you like to share anything else before we go to the questions?
Yeah, I just think it's just really important that society recognizes just how important caregivers are. I just don't think it's right that, in some way, shape, or form, they may feel that, oh, well, you don't have the education of a LPN or a RN or a doctor or what have you, so you should not be compensated. I just, I can't see how that is, really factored in, because even before I did the home health care, I worked for years as a patient care technician in dialysis. And even in that setting, we knew more about the patients than the nurses or the doctors. They had to come to us to ask us about the patient's access or how's the blood pressure, this, that, and the other. And it's the same thing with the caregiver. When you're in that home, I knew more about the patient than the husband or the grandkids or anybody. I was asking the questions, answering the questions that the nurse was asking, or the doctor was asking. So it's just we're very important, but we are undervalued, and that kind of it hurts. It stings. It really does, because even though I said that I stopped working when the pandemic hit. And the main reason that I stopped was because my son had just lost his father. He was concerned about my health, being out there and working, and I couldn't take the chance of getting sick and him losing his mother. So that was a personal choice that I had to make. But I'm quite sure a lot of other people have had to make that choice. And I can say that I'm fortunate. My husband provided very well to where I don't have to worry about that at this particular time. But not everyone is in that situation. And I miss my job. I miss caring for the elderly. I miss being with them. And it was rewarding to know that I could be there and that I could make someone's day. And to actually, I had one little lady, she died right before Christmas last year. But she used to tell me every day that I was there, you have no idea how much I appreciate you, how much you mean to me, how much I rely on you. And that in itself was a reward, because I was appreciated. We just, caregivers are very important, and they need to be rewarded. They need to be compensated. They need they need a proper salary. Like I think Maya was saying, in some areas, $15 an hour is just like $5 an hour. We need to be paid. We really do.
Thank you so much. And now I think we have just only a few more minutes for questions. And so I'm going to just see here. Let's see, how can there's a lot of comments. A lot of folks are agreeing with what you shared today as far as the compensation, also some of your experiences that you've had working or trying to work through and with systems like healthcare. So I'm not sure how we should choose the questions because there's a lot of great
If you want
comments.
me
and
to-
everything.
if you'd like me to help, I know there
Yeah.
were a couple of questions that came in.
Okay.
And thank you to all the panelists. Yeah, everybody is very moved by your experiences and stories. And you talked about some strategies already that you might recommend to support caregivers, but are there any other strategies that you would recommend for people who might be in similar situations as the ones you described, in addition to what was already shared?
I would probably say, don't be afraid to ask for help. I know that sometimes we get in a situation where we feel like no one can do it better than me, and I am bad at that. I probably shouldn't even. I know that it's the right advice to give, but I can honestly say that I probably wouldn't even, if I had to do all over again, I probably would not because, but you have to kind of let go and not be afraid to ask for help, because now when I look back on it, um, why didn't I call up some of my husband's nephews and say, look, you know, your uncle has got to go to dialysis tomorrow morning, and can you come and clear the walkway for me? You know, but I mean, I was doing it myself. I would get him up, get him ready, get him settled with breakfast. My son was in school. I didn't want to wake him up because he had to eventually get up to go to school. So I'm putting on my boots and I'm going out there with the shovel and I'm shoveling snow at 2:30 in the morning. But why didn't I ask, you know, ask for help or even just hire somebody to do it, you know?
I have to agree with Jackie as well. I don't know what it is when you become a caregiver where you just feel like you need to do everything yourself. And I know at one point my husband was deployed. Well, no, two times he was deployed to Iraq, and there were people who just stopped asking me if I needed help, and they would just show up and do things without even asking me, because I would always say, no, I'm fine, I'm okay. And at that point, you know, my boys were all young and just trying to do everything on my own. And at the time, because our insurance paid for our nursing, because my husband got deployed, they stopped paying for our nursing. And so we had to use Cobra to pay, and that provided very little nursing. So I had to just ration it and get like 2 nights of nursing a week, and that's all I had. And then I had to do all of it myself. And so I don't know why I didn't like engage like informal supports, like have people from our church come and teach them. But I just felt like nobody could do it like I could. And I will say, by the time my husband got back 3 years later, essentially, I was ready to be hospitalized myself. So I don't know what the point of all that was, what I was trying to prove, but if I had it to do over, I would sure like use informal supports a lot more than I did, because now I'm like totally worn out. So.
Yeah, I was gonna say, particularly when it comes around to birthing people, in our country, we are so focused on the baby and not the people who are actually giving birth or their partners. And it goes back to that conversation, that discussion I was having about we have to become a more collective society, because you don't know what is going to happen throughout the course of that birthing person's experience. A lot of times I've seen and experienced myself personally, like postpartum depression and not really having an outlet or not having anyone check in just to see how you're doing or that you need help. And I think we have done a horrible job with communicating needing help as an individual being lazy, particularly for working class families. It is not a luxury to hire someone to come in and clean your house. Like if you need help, that's the type of support that you need, or if you need someone to cook. So I think we just have to reframe how we're using language when it comes to the type of support services that individuals need, because it's not a luxury. No one should be able, and no one can do all of these things by themselves. And I think it goes back to Jackie, it will make people start to feel at least more comfortable saying that they can't do it all, or that they're okay with accepting help, because we've all, just because we've been told so many times that, you know, you're the caregiver, you're the person responsible for the household, you should be able to do it all, and if you're not, you're doing something wrong.
Mm-hmm. So I'm not sure if we have any more time for other questions. There are lots of comments here, so I'm wondering if it's possible for the comments and questions to be shared with the panelists after today's session. Because
Yeah,
there are,
I think that's possible. And there was a specific question for Debbie about the waiver for her son for paying the extra bonus to nurses. So I don't know if you can follow up with that person. We can connect you afterwards to follow up with them for more information.
Okay,
That's okay?
that'd be great.
So I want to thank Debbie, Jackie, and Maya for being a part of this panel and for sharing their stories, their wisdom. And now I'm going to turn it back to Keely. And also want to thank the y'all for joining us today. And now I'll turn it back to Keely.
Thanks so much, Shalisha. So please join me in thanking the panel again, including Shalisha. Your stories are powerful, and speaking for myself, I'm humbled and inspired by your strength and compassion. Just last minute housekeeping, we will now break for 10 minutes. The next session starts at 2:50 Eastern Time, 11:50 Pacific Time. On this sort of channel for equity, we're talking, it's a conversation around championing dignified caregiving. There's also the policy and the innovation track. So have a good break, and looking forward to seeing you in the next session. Thank you all so much.